Yes, yes, it's World Antimicrobial Awareness Week, and there have been a lot of content, advocacy, discussion around antimicrobial. There have been a lot of actions. People have done a lot of advocacy as well as intervention in order to prevent antimicrobial resistance. But today, we'll be having an holistic discussion that revolves around the topic of firstly the theme for this antimicrobial awareness week, which is act now, protect our present, secure our future. So if we are calling to action as far as antimicrobial awareness is concerned, we need to emphasize and we need to target our efforts in such a way that it will cover all aspects. We should not be one side. If we are trying to solve a problem, we should approach it holistically in the sense that we want to tackle an issue, which is the issue is a little bit dynamic. There is a different face to it. There should be we have more than one face to it. So we should not just approach it on the surface or one-sided. We should not be one-sided if we are trying to plan a kind of intervention in as far as the project is concerned. So that is what brought about the nature of this webinar. Okay, that's what brought about the nature of this webinar. Why the reason why we have different people in the different stakeholders from different aspects of health as well as the environment, such that this discussion would be cut across different aspects as far as antimicrobial resistance is concerned. The first person we have on our list is Miss Alawode Taiwo. She is an environmental health specialist. We also have Farm Apelona Apelona Pelumi. She's a pharmacist. I'm sorry if I don't get the pronunciation correctly. We also have Dr. Oluwatosin Ajayi Oluwabamiṣe. She's a veterinarian and AMR advocate. We have Professor Beverly Idri. She is an AMR focused bacteriologist. And we have Miss Amarachi, health promotion and communication specialist. These will be our facilitators today, and we are going to be interacting with them. We are going to be discussing how to approach AMR, how to how to plan our intervention for AMR in such a way that it will course across all sectors of health, including the environmental health as well. Also, we have an health promotion and communication specialist because we have seen a lot of program and interventions about AMR, and we need to be very, very careful while trying to address this issue in order to avoid any form of miscommunication or misinformation. So we also have an health promotion and communication specialist in our midst. So this will be more like a brief introduction because of our time. We spent more time waiting for others. So we are going to be going into the question and answer session right now. Please hold on a minute. Okay. Okay, before we go into it, please, I need a response to be very sure that I am being heard clearly. Can somebody unmute and speak?
Yes, we can hear you.
Okay, thank you very much. So, for our session today, we're starting from Fam Pelumi. I hope she's on the call and she can hear me clearly.
Yes, I can hear.
Okay, thank you very much. So, can you quickly give us a short introduction of yourself and tell us what you do, and as well as your impact or your contribution to the advocacy of antimicrobial resistance before I take the first question? The first question is for you.
My name is pharmacist Oluwapelumi Apelono. I I finished from the University of Ibadan, and then I'm currently practicing in community aspect of pharmacy practice. So I'm a postgraduate student also in the Department of Clinical Pharmacy and Pharmacy Administration at the University of Ibadan. So, and I'll be talking today, answering so many questions about antimicrobial resistance. And one of the roles I keep playing in my daily practice as an advocate for antimicrobial resistance is ensuring that there is rational and responsible use of antibiotics in in our practice, because it's fast becoming a pandemic, though it has not been publicly declared as a pandemic, but we are getting there because there has been so many reported cases of resistant infections and increased hospitalizations. A lot of people are coming down with antimicrobial resistance and increased healthcare costs. So in my daily practice, I ensure that when customers come to the pharmacy, because they just come directly and they consult us, and then we have to like recommend. So sometimes some of them just walk into the pharmacy and they just want to get an antibiotic for no just cause. So I ensure that the antibiotic is actually needed. And in many cases, I refer them to carry out a diagnostic test, proper diagnostic test, because if someone comes, generally speaking now, if someone has stomach pain, and we are giving the person a drug for headache, it doesn't cut it. So even if there are many types of antibiotics, so we want to make sure that we are giving the right antibiotic for the right cause, if there is even a reason at all for it to be used. So I usually refer them to carry out tests or go for proper consultation if it is something that is not simple, that can be handled empirically. If there's a need to, for proper clicking by a doctor and proper tests before we can even prescribe any antibiotic at all. So thank you very much for giving me this platform to speak about antimicrobial resistance.
You are welcome. You are welcome. Thank you very much for the introduction and the insights. So my first question is that pharmacies are at the center of antibiotic access and regulation. How can pharmacy practice help in curbing antimicrobial use? So we understand that the pharmacists are the forefront of dispensation of drugs generally, including antibiotics. But how can pharmaceutical practices, and while doing their work, how can they help us curb antimicrobial misuse?
Right. So pharmacists are basically central to antibiotic access and regulation. And so it is very important. We have a lot of roles to play, actually. So, and a lot of studies have shown that pharmacist-led interventions can actually reduce inappropriate antibiotic use by up to 50%, especially in outpatient settings. So one of the roles that pharmacists can play is medication stewardship. Medication stewardship is ensuring the rational and responsible use of antibiotics for the right purpose, for the right cause. Another way pharmacists can ensure that the responsible use of antibiotics and curbing its abuse is ensuring that education is put in place. Like, you educate your patients as to the reason why they are being given antibiotics, because we've had many cases of patients stopping antibiotics midway when they start feeling better. And and the reason why these microbes in the first instance, talking about bacteria, viral, fungal, and so many others like that. The reason why they are able to develop resistance is because there's something called minimum inhibitory concentration. I'll break down my jargon. So minimum inhibition concentration is actually the concentration level at which an antibiotic must reach before it can start to exhibit its effects. You know, there's a point where it gets to kill the antibiotic, kill the bacteria or the microorganism completely. So what happens is that when antibiotics are being used, they start working, but not to the maximum level where they can completely kill the bacteria. So, and that is what gives this placebo effect. Like, okay, they start feeling better after a few days, whereas complete killing has not taken place. It has not gotten to the concentration level or the peak plasma concentration. That is the level at which the bacteria is completely eliminated. That is why we have a complete course of antibiotics. Sometimes we have for 5 days, for certain first generation antibiotics. Some of them might be used for 5 days. Usually, some of them are required to be used for 7 days, every 12 hours. So there's a reason for that time frame. So patients do not understand the reason why they need to use antibiotics for such a long time. I mean, 7 days is a week, so it can be a lot. So educating patients as to the reason why they need to use and complete this antibiotic is one of the ways we can curb antibiotic resistance, because the moment you stop at day 3, the microorganisms start to develop different mechanisms. Some of them secrete chemicals, some of them change their shape and form, such that when you use that same antibiotic for that same reason, it doesn't eventually have any effect at all. So apart from educating patients, we can also collaborate with doctors, nurses, other public health professionals, veterinarians, in ensuring that there's responsible use of antibiotics. So usually we have it's a whole ecosystem. We have the environmental health, we have the human health, we have the animal health. It's a whole ecosystem. So there must be like a collaborative approach to antimicrobial resistance. We have to work with doctors. Usually, sometimes when patients come with prescriptions to the pharmacy, I put a call across to the doctor to ask the reason why this antibiotic was recommended in a polite manner, because we know there's this kind of rivalry between doctors and pharmacists. So we want to know why this patient is using this antibiotic, for what reason. And some of them bring prescriptions from quacks, which are usually flagged anyways. So you must, have a good relationship with doctors, nurses, understanding why this patient is placed on this particular medication, so that we can reason together and ensure, the point of the whole thing is optimal patient care. We want to ensure that our patient gets better. So another thing we can do is surveillance. There's in the different stages of drug development, we have the phase 1, phase 2, phase 3, we have post-market surveillance, which is, not directly related to this, but surveillance is just, we want to study prescription patterns. We want to understand when patients come to the pharmacy and they come with different diagnostic tests from different labs, you can see there's a constant. Maybe there's a particular antibiotic, maybe amoxicillin, or maybe ciprofloxacin. You are seeing that patients are resistant to this particular antibiotic. What is causing it? What is the reason why? You want to study that pattern and ensure that you as a pharmacist can come in to play a role. So because a lot of people work in this pharmacy and they just buy antibiotics mindlessly for reasons best known to them. Some of them say they want to flush their system. So I ensure to tell them that antibiotics are not flushers. They are required for a specific reason. And then community engagement is one of the ways pharmacists can also play a role. You can lead awareness campaigns, you can organize outreaches, and use that as an avenue to educate people, to create awareness, in your local setting, the community, because that is where they need it most, because, especially in areas where they are not so literate. So you break it down as simple as possible. So they don't just say, okay, I need antibiotics, I just need to just, So in areas where the awareness and then information has not gotten to, we need to get there. We need to use the tools available to us. We can use the social media, which is what some pharmacists are already doing, and which I still plan on doing. So thank you very much.
Thank you very much for the answer. We really find it insightful and educating. I want to make a request. If you are comfortable switching on your camera where you are, some of our listeners might want to see the face behind the voice. And also, we are under a time frame. So the next question I'll be asking you, you should try as much as possible to go over it within 2 minutes, ma. So we still have other facilitators and we still have a long way to go as far as this session is concerned. Under 2 minutes, please help us do justice to the second question. Over-the-counter sales of antibiotics without prescription remains common in Nigeria and many other African countries. What drives this practice? One, and also what are the public health implications of this practice?
Right.
Should
So
I,
thank you
should I
very
go right?
much.
Thank you. You can proceed in 2 minutes.
All right. I might not be able to really show my face because I'm in between work, but
It's fine. It's
I
fine.
don't, I
Go
don't know
on.
if all right. So thank you very much. So over the counter medications actually is one of the common ways antimicrobial resistance spreads. So, and this is because we have a lot of walk-in patients, especially in my practice community. So a lot of them avoid going through the stress of consultation in the hospital. So they don't want to have to queue for hours and, so many reasons like that. So usually, they come to the pharmacy, they just say they want to buy antibiotics. So, and some of the reasons why they just want to come into the pharmacy to buy these antibiotics because maybe a friend had told them that they needed to get antibiotics. Maybe they just feel they just want to use it. So, and one of the reasons why over-the-counter antibiotics are selling so much in Nigeria is because Nigerian pharmacy practice, drug practice, they are business oriented rather than result oriented. They just want to sell. So we have a lot of pharmacists stocking up medications and they don't even care. They don't care to ask any questions. And one of the things that I think is causing these issues because there are no regulations put in place. There are actually regulations. We have NAFDAC, we have NDLA, we have a lot of drug bodies that should be checking these things, but they are not concerned if it is not a big drug case. Whereas it's actually a ticking time bomb. And so one of the ways I think this can be curbed is to try to reach out to regulatory bodies, collaborate with them, let them hear us, let them know that this is actually, an issue that can boomerang later. So they need to come into it in whatever ways, whatever connections that we have, whatever policies and regulations that have been put in place to ensure the rational use of antibiotics, ensuring that doctors are prescribing these medications. They are not just writing it because maybe drug reps want to sell, or maybe they are under pressure for business sales and results. Thank you very much. Hello, sorry, I'm done talking.
Okay, thank you very much, Ms. Dr. Pharmacist Pelumi, for your insights. Thank you very much. So we'll be moving on to the next question. So this question is, okay, so sorry for that. So this question would be directed to Dr. Oluwatosin. Dr. Oluwatosin, can you hear me?
Yes, I can hear you. Good afternoon.
Okay, good afternoon. So please, can you use, let's say, 1 minute to introduce yourself to us?
Oh, okay, thank you. Thanks to the organizers and everyone for having me here. Oluwatosin Ajayi Lubamishi. I'm a veterinarian and a public health and preventive medicine professional. I work with One Health Trusts, a US-based organization, a public health, global health US-based organization, as a research analyst. So basically, I'm very passionate about antimicrobial resistance and my daily work. I do a lot of advocacy. I get invited to a lot of places within and outside Nigeria to talk about antimicrobial resistance, to educate people, to encourage the youth to get involved in antimicrobial resistance. And in my organization, as a research analyst, I contribute to designing policy brief, antimicrobial resistance, situational analysis, and policy briefs for government for countries across Africa, Asia, and all, which actually help governments and relevant stakeholders to know the state of antimicrobial resistance in their country, and we provide recommendations for them on how they can, how they can combat this global pandemic. So I think that's basically who I am and what I do. Thank you.
Okay, thank you very much for the introduction. It's really nice to have you on the call.
I guess Dr. Adele is having issues with network.
Yes. Okay, sorry, I'll just continue. Thank you so much, ma'am, for introducing yourself. So I'll just move straight to the question. So my first question is, antibiotics use in livestock production is often cited as a driver of antimicrobial resistance. So what practices in animal health need urgent reform? Do you get my question, ma'am?
Sorry, can you go over the question again?
Okay. Antibiotic use in livestock production is often cited as a driver of antimicrobial resistance. So what are the practices in animal health that need urgent reform?
Oh, okay. Thank you for that question. Yes, you are correct. There are a lot of reports that actually validates the fact that antimicrobial use in livestock production generally is a huge contributor and a huge driver of antimicrobial resistance globally. Yes, that is correct. So talking about practices that actually drive home this issue, I'll mention like two or three of them because of our time. So the first one I would want to highlight is the over-the-counter access to antibiotics. Pelumi mentioned the other time how it is an issue in human health. And I tell you sincerely, it is also a very big issue in animal health. We have a lot of drug shops around, and where any farmer, and this issue also, let me say, it goes beyond livestock production, even to companion animals, pet owners. You see farmers, you see pet owners, they just walk into any veterinary drug shop they see, and they make requests for antibiotics. And of course, they are sold to them. They get them, they use them, whether that is the right antibiotics or not. They don't know, they don't care. Maybe the last time the farmer had an outbreak in his farm, maybe the vet that came around he observed that the vet used, let's say, oxytetracycline, and he just feel, okay, this is a similar symptom, just go to the drug shop, and he gets it. There is no diagnosis, there is no prescription, nobody is monitoring if the drugs were well used or not. So this is one of the main issues of this is one of the main issues in the animal health and livestock production sector. That's one of the first things I want to highlight about the factors that drive antimicrobial resistance. So the second one I want to talk about is the routine use of antibiotics for growth promotion. Although this has been discouraged a lot, but the fact remains that people still use them. The use of antibiotics are supposed to be used as therapeutic agents. I mean, they're supposed to be used for treatment of diseases, not as prevention, not as growth promotion agents. So, and these are things that contribute to antimicrobial resistance in the animal health, in the livestock production sector. That another thing I wanted to highlight was the fact that farmers think that antibiotics can make up of their poor infection prevention and control practices. Antibiotics is not supposed to be used as a tool to make up for their poor sanitation and hygiene practices and all of those things. But again, these are the things that drive home the problem of antimicrobial resistance. So these are the things I can readily highlight as the drivers of antimicrobial resistance in the animal health sector. Thank you.
Thank you very much, Dr. Tosin. So I would be moving on to the next question. So the next question says, how can we balance animal welfare, food security, and AMR prevention in agricultural system?
Okay, sorry, can you say that again?
How can we balance how can we balance animal welfare, food security, and AMR prevention in agricultural systems?
Okay, so how can we balance animal welfare, food security, and AMR prevention in agricultural sector? Okay, so one thing that I need to first of all say is they are all linked. One is linked to the other. You understand? So when we talk about animal welfare, we are talking about how we can make the best care available to the animals. And the first thing that we need to first of all know is the fact that good animal welfare reduces antibiotics. The animals are well taken care of. There is good sanitation and hygiene system, proper biosecurity, they are well fed, and all of those things are put in place. They will fall sick less. There would be no room for infection, for any form of bacterial infection that would actually call for the use of antibiotics. And that is one of the things that we advocate. When proper biosecurity measures are in place, the animals are not sick. Is it not the person that is sick that would be treated? There will be no need for antibiotic use. So that way we would limit antibiotic use, and we would have greatly curbed the development of antimicrobial resistance. And of course, we know that food security depends on productive animals, not the over-medicated ones. And that's one of the things I was trying to highlight the other time. Leaving the things that are supposed to be done and just pumping the animals with antibiotics, it will not help in any way. So the point I'm exactly trying to make is that animal welfare, food security, and antimicrobial prevention, antimicrobial resistance prevention, one is linked to another, and it starts from good animal welfare. Let the farmers allow their animals to be vaccinated on time. Let them have very good biosecurity measures in place. Let the animals be well fed and taken care of. So when these things are in place, the animals are fine. There is no outbreak of any form of infection, and there will be no need for antimicrobial use, let alone talk about the development of resistance. So in summary, what I'm trying to say in essence is that let them be well managed. And even when they are sick, part of good animal welfare is taking care of them well. So which involves when they are sick, get a professional veterinarian to treat them. When the veterinarian makes a prescription, let's say administer these antibiotics for 5 days, stick to it. Don't say you want to use for 3 days so that you can keep the rest of the antibiotics for the next time that the animals are down. Don't do that. So the very good animal welfare will equate to the animals staying healthy. And when they are healthy and they are well, of course, there is more guarantee for food security. And that way, we would have minimized the usage of antimicrobials and contribute to reducing the spread of antimicrobial resistance. I hope that answers your question. Thank you.
Okay, thank you very much for the insightful session. We apologize for the glitches. So thank you very much. We are going to move on to Mr. Iwo now. She's an environmental health specialist. I want to be sure if she's still with us here.
Yes, I am. I can hear you clearly, Habib.
Thank you very much, Ma. Our first question is that you can take a minute to introduce yourself after I read out the question. So you go on with the question after your brief introduction. The environment is often the silent reservoir of antimicrobial resistance. What are the main environmental sources and transmission pathway. So I want you to shed light on the environment as a reservoir for antimicrobial resistance, and how does the environment serve as a source and a transmission pathway for antimicrobial resistance?
Okay, thank you so much, Habib, for that, Dr. Habib, for the question. My name is Taiwo Alawode, and I'm an environmental health specialist, and I think you should have access to my bio by now. So I had my MPH in environmental health from the University of Ibadan, and I had my MSc in epidemiology from the University of Edinburgh, United Kingdom. And so I've done a lot of research when it comes to environmental health and environmental surveillance and AMR. Basically, the environment is beyond a silent reservoir. So many researchers found out that the environment plays a very critical role when it comes to the spread of AMR. And the reason for that is because, wastewater from the hospitals is where we treat infected people's, right? So the wastewater do come into the environment. Everything leaks into the river, for instance. They go into the water bodies, and we use the same water on our farm animals to feed the animals, the water they drink, and even when it comes to irrigation, the water we use for irrigation and all of that. Then aside from that, even the waste we generate from our various homes, especially in developing countries like Africa, where the waste water system is not like highly developed and highly well managed. So all of this is like creates an avenue for these antimicrobial resistant pathogens to thrive. And there's what we call horizontal gene transfer. And when these microbes are in the environment, when they're in the water bodies, they can interact with each other. For instance, let me give a relatable example. If you have a friend and you need something that you don't have but your friend have, when your friend gives you that particular thing, what happens? You both have that thing. So that is how horizontal gene transfer works. It's just like bacteria trying to share defense mechanisms against antibiotics among themselves. And when this happens, and the environment is a very good hotspot. Research has shown that it's a very good hotspot for this exchange of gene transfer to microbial resistant gene transfer to occur. So the environment is beyond just a silent reservoir. It's actually a very critical reservoir for AMR. And just like you were asking me, there are various avenues in which this can take place. Like I've earlier mentioned, the wastewater from our hospitals is a very good source of AMR generation. Then also manufacturing companies like pharmaceutical companies, for instance, they produce these antibiotics. And for instance, some of them do not have a very good wastewater treatment facilities, and this wastewater gets discharged into the rivers, and then this can create a lot of atmosphere for the antibiotic resistant pathogens to thrive and also multiply and share their genes among other pathogens. So this is also a very good hotspot for them. Then also, even when it comes to human waste, like I've earlier mentioned, also when these wastewater are not properly treated, it's also a very good avenue for these resistant pathogens to also thrive and also develop and share their resistant genes. Yeah. I hope I answered your question.
Yes, ma'am. Thank you so much for that insight. So I'll be moving on to the next question. So next question says, what policies or monitoring systems are needed to track and reduce antibiotic residues in the environment?
Okay, so number one, it starts with us looking inward. Where are the hotspots? Who are those that are generating these wastes that get discharged in the environment? So policies such as strict regulations for pharmaceutical companies that generate this waste is very, very essential. So for instance, they are not allowed to discharge their wastewater if it has a high load of either bacteria or resistant pathogens. So having those kind of structure in place, and it's not just having the structure in place, but making sure it is enforced. So policies that are being enforced and implemented is very, very essential. that's like a starting point. Then also for developing countries that have, poor wastewater management, I think the government can also put in policies and regulations where, there's what we call decentralized wastewater system, or even the centralized one, where, wastewater can be pulled into a wastewater treatment plant and properly treated. And, a lot of tests is being carried out on the water, for instance, the microbial load and all that, before it's being disposed into the river or the water body. So that is also very, very essential. Then also another way in which we can reduce residues is also to ensure that pharmaceutical companies, they follow strict regulations when it comes to like that disposal of not just the wastewater, but also even antimicrobial residues that they produce in their company. How do they dispose this waste? Maybe in form of solid waste, for instance. That's also very, very essential. There has to be strict policies regarding this. But most especially also, for instance, there's a lot of open defecation happening around, and especially in Nigeria. And this is also due to, poor like water sanitation and hygiene. So there is a need for government to also step in, working along with private sectors and even companies to ensure that everybody have like each school. Some schools in Nigeria, for instance, they don't even have good toilet systems. We've done a lot of advocacy outreach to schools, and they don't have the water, they don't have sanitation equipment and all of that. So it starts with the government also stepping in to ensure that every school, for instance, has a good wash facility. Every company has a good wash facility, even at the university level. I can remember, I don't want to mention names, but I've been to university where, when you get to the toilet, you're like, really? And even within the School of Public Health, and you're so surprised. So I think there has to be strict enforcement of wash facilities in companies, in schools, and in general public spaces, even in marketplaces, and ensure that this waste, after it's been produced, is properly discharged, treated, and then discharged into the water bodies. So these are some of the policies that can be implemented to ensure that we have a safe environment that can also foster public health.
Okay, thank you very much, Miss Taiwo. I hope we are all taking down notes and preparing to ask if there's anything you do not really understand, ask question at the end of it all. So now we'll be moving on to our next facilitator, and here we have Professor Beverly Egia. She's an associate professor in the bacteriology department at the Noguchi Memorial Institute for Medical Research, University of Ghana. Hello, ma, welcome.
Yeah, thank you so much for the invitation.
Okay, thank you very much, ma. So I would be moving straight to the questions. So the first question is, how does misuse, overprescription of antibiotics without appropriate tests in hospital contribute to resistance? And what measure can clinicians take to reduce this trend?
Okay, thank you so much. So, basically, as we all know, resistance is facilitated by use of antimicrobials. So the more we use antimicrobials, the more resistance emerge, because as we use this agent, there's some form of selection pressure to select the ones that are resistant to the specific antimicrobials that you are using. So as we use these agents in our hospital settings, using it without testing, most of the labs on our continent at this time are unable to test for, first of all, bacteria or identify them, as well as test for what antimicrobials they are resistant to. So if we are not able to test and we are using these agents, it can lead to emergence of resistance because we are just using it often when it's not needed, or we are even using it within a duration that is not appropriate to expose these bacteria species or organisms excessively to these agents, and then they will also try to evolve, because the more you bombard these germs with the agents, they will try to escape, or they will try to mutate, they will try to change themselves so that they can survive. So as we are using these antimicrobials without indiscriminately, that action leads to emergence of resistance. So what we can do is to make sure that, first of all, we are adhering to the policies that are in place. I don't know about Nigeria, but in Ghana, antimicrobials are not supposed to be dispensed without prescription. The regulation is there, but adhering to this regulation is a challenge. So people can walk into the pharmacy and, just explain the situation to the pharmacist or the licensed chemical seller, and antimicrobials will be released or dispensed for use. So it's just because the rules or regulations are not enforced. So people are using the antimicrobials indiscriminately, or using it when it's not supposed to be used. So for example, if people have coughs and colds, they are not supposed to use antimicrobials, but you have people walking into pharmacies and just getting antimicrobials and all that. So to prevent resistance from emerging, we need to enforce the regulations that are supposed to guide the use of these agents. We also have to test, so that we know exactly what we are dealing with. That means that our laboratories should be strengthened to be able to test for these organisms. Not just testing, but knowing what they are susceptible and they are resistant. In the recent MAP reports, maybe you might have read it, MAP reports was produced by ASLM some time ago, and it indicated that about 1.3% of laboratories across Africa or the continent are able to do bacteriology and testing of antimicrobial agents. So if very few labs are able to test, it means that several of our clinicians or physicians managing the patients may be managing the patients largely empirically. Empirically, not even empirically, I would say, but because empirical base will be based on some level of data, probably not current. But people are being treated largely without information, because the labs are not testing and they are not able to know what exactly is happening with a particular patient. As a result, we are using these antimicrobials indiscriminately, could be appropriate, inappropriately, or excessively, and all that. So we can reduce emergence of resistance by testing and using the antimicrobials only when they are needed, within the period when they are required. So these two, among a number of things, can help in the reduction of emergence of resistance, because if we don't use the agents excessively, we will not have extreme resistance emerging. So I think that's what I can say for now. Probably as we engage in the discussions, we'll be able to have or discuss more ideas. Over.
Okay, thank you very much, Ma, for that insight. And I hope everybody is still following at this point. So I'll be moving on to the next question. So the next question says, how can healthcare workers collaborate more effectively with veterinarians and environmental experts to monitor and control AMR?
Yeah, so like we all know, antimicrobial resistance or tackling antimicrobial resistance is not just one person's responsibility, it's a team sport. So we need everybody to come on board to be able to tackle this menace. And because these organisms move from humans to animals and the environment, it's important that we collaborate extensively, to be able to tackle these menace. So we can't just say that, oh, we are tackling AMR only in human health or the environment or in animals. We all have to come together, which will require sharing of data amongst ourselves. So if, for example, there's an awareness creation activity, it's important to bring all the stakeholders together. So the human health will share their findings, animal health will also share their findings, environmental health will also share their findings, and then we'll all get to know what exactly is happening within the One Health space. And based on the data that will be shared, we will all know how to tackle this menace. So it's a team sport. Tackling AMR is a team sport, and everybody is encouraged to come on board to be able to tackle the menace. And this will require extensive engagement, with each other. Having meetings, because it takes time for individuals to come to the same page when it comes to dealing with a particular situation. And we have to be patient enough to engage for as long as we have not seen results. We should engage till we see results. So it's important to engage extensively among each other, and as we move on our journey to tackle antimicrobial resistance, because it is a multi-sectorial event. Over.
Okay, thank you very much, ma'am. Thank you so much. Okay, we'll be moving to the next facilitator, and then we'll come back to ask a general question for that all the facilitators can just answer. So we'll be calling on Miss Amarachi. Miss Amarachi, are you here? Can you hear me?
I'm here.
Okay. Ms. Amarachi is a health promotion expert, a health communication expert. So I'll be moving straight to the question. So the first question is, AMR is a complex issue that the public often misunderstands. What communication strategies are most effective in improving public understanding and behavior around antimicrobial use?
Hey, good afternoon, everyone. I'm so excited to be part of this conversation. So, first of all, I'll start with one of the biggest barriers we face is that many people, like so many people, AML sounds like something that is very far, something that is distant, something that is technical. But in reality, AMR is already affecting us all here in Nigeria. So research has it that about 70 to 75% of Nigerians will self-medicate antibiotics, especially for respiratory symptoms. So back to the question you asked.
Sorry,
Going
Miss Amarachi, I'm so sorry to interrupt you. Can you, you're not really audible. Can you maybe speak louder?
Can you hear me?
Yes, I can. Yes, I think it's better now.
Hello. Oh, shit.
Yeah, you can go
Can you hear
on.
me?
Yes, please, you can go on.
Can I go ahead?
Yes, please go ahead.
Okay, thank you very much. Sorry about that. Okay, I was saying that we have tools in which this like communication strategies in which this can be passed appropriately. For using the SMCRF model, that is the S, which stands for sender, the M stands for message, the C stands for channel, the R stands for the receiver, and the S stands for feedback. So for the sender, people tend to trust familiar and credible voices. So when people like the community leaders, the youth leaders, doctors, pharmacists, nurses tend to pass this information and it's coming from a trusted source, they tend to give like listen ears. And when this message is being passed across, it should be very clear, making it very clear, making it very short, and messages like, okay, antibiotics don't treat cold or flu. Finish your prescription. Don't share your medication. So messages like also take antibiotics only when prescribed. So short, consistent message. It has a way of changing behavior very fast, faster than longer explanations. And these channels, how would this message, how do you want to channel it, or what channel do you want to use? There are several channels. So we have channels like the radio jingles, and if you want to use radio jingles, you're passing it in their local languages, languages that can be easily understood. So you can't pass a message to a community that we just have people who are outside who dwell in that community, and you're coming there, you're passing your channel of communication in Yoruba. You've not passed any message, so you have to use the right channel. Using the right channel matters. Having posters in pharmacy or using town hall discussions, and in our modern time now, also using WhatsApp voice notes, using storytelling, role drama, all of this can also be a channel on how this message can be passed. Then the next one is, I've talked about sender, message, channel. The next is the receiver. You have to know your audience, know what your audience believes, know their behavior first of all. So most of the time, parents will be like, I take um I take antibiotics so that I give my child antibiotics for quick relief. And for youth, most of them will be like, I self medicate too because it's very cheap and it's easy for me. So we have to know our audience. We have to know all of this, their beliefs first of all, the people you want to relay this message to, and the feedback, which is the last, is a two-way dialogue. So when you ask it, when after you've educated them, then you give them room for them to clarify what you've asked them. You could even ask them questions like, um, I always give antibiotics when my chicken, sorry, excuse me, when my chicken, I'm trying to like construct like give an example, but let's leave that aside. So you would give like a dialogue, make it a two-way interaction. After speaking, you give them room for feedback, hear from them, hear their own concerns. So in doing that, it makes the communication process very easy, very understanding, using the right channel, like I said, using trusted individuals. This all of this coupled together will also make this communication strategy go well. I hope I'm able to answer the question.
Yes, you are able to. Thank you so much, Miss Amarachi. So I'll be moving to the next question. The next question is, What indicators can be used to measure the impact of health promotion campaigns on antimicrobial stewardship?
Sorry, can you come again? I didn't get that.
What
Hello?
indicators can be let me repeat the question.
Okay.
Okay, so the question is, what indicators can be used to measure the impact of health promotion campaigns on antimicrobial stewardship?
Okay, first of all, we can measure this effectiveness by after all of this has been done, like the campaigns and educating them, then you first of all know their knowledge change by knowing how many people know about antibiotics, how many people don't just take antibiotics because of they want to treat viral infections, how many people have reduced self-medication, and that's like in the behavioral change. You can also tend to know the prescribing trend. How many percentage of pharmacies, how many percentage of them are still selling antibiotics without them bringing a doctor's prescription regarding getting that antibiotic, and also engagement metrics. This can be done by, for instance, knowing how many community members um, 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 are able like to interact with you after this whole section, how the number of school sections have been held, the number of people that the message has been reached out to. So this is being done. We're not just looking at the people hear the message, but we are looking at the behavior at the end of all of this, the behavior or the system, this change. So awareness is actually only one step, but the behavior change and the improved health outcomes are the real success of all of this. Thank you.
Okay, thank you very much. So I hope we are all taking notes. We are all noting everything that every one of our facilitator has been saying. I would not want us to, just attend this webinar and then go back without getting, because they've been saying very valuable and insightful things. Let's not just attend and go back like that. So I'll be asking a general question now to our facilitators. It's an open question. Every one of them is allowed to answer. So the question is, why is a multi-sectoral approach involving human, animal, and environmental health so critical in tackling AMR? And if you can you share an example of a successful One Health initiative or collaboration that has helped reduce AMR risk? So this question is open to any of our facilitators. You can answer.
Can everyone hear me?
Yes,
Yes.
I can.
Oh, okay. All right. Thank you. Okay. So the question is why multi-sectoral approach is really important in tackling antimicrobial resistance. Just like quite a number of the panelists have already pointed out, antimicrobial resistance is not an issue that can be handled by some sector. Antimicrobial resistance does not know sector, does not know boundaries. And an example I'm going to give is an example of that is I was talking about the inappropriate use of antibiotics in livestock production the last time. And a farmer that does not observe withdrawal period, for instance, a withdrawal period is the minimum time that the system of the animal require to get rid of the used antibiotics excretes out of the system entirely. So when a farmer does not adhere to that, the residue of the used antibiotics remain in that animal. And when the animal is slaughtered, it ends up on the table of the consumer. So that means a human that says, okay, thank God, I should not have any problem with antimicrobial resistance. After all, I don't use antibiotics. But such individual could indirectly consume antibiotics from the beef that the person eats on, from his or her kitchen, from his or her plates. So, and you see now, so that way, the carelessness of a farmer eventually affects human. And then you will now find out that this individual is sick and the antibiotics are not working. Why? Because the person has been consuming antibiotics indirectly from the food. And now the pathogens that the person is infected, they are already resistant to many of the available antibiotics. So this points how multi-sectoral approach is really, really very important. All ends have to be on deck. The human health professionals, the academics, everybody, we have to come together to tackle antimicrobial resistance. No one sector can single-handedly handle it. So now talking about an example, during my introduction, I mentioned it that I work as a research analyst with One Health Trust, which actually is a World Health Organization collaborating center. So when Nigeria was going to develop the second national action plan, which was done last year, we had the first thing that we had to do was conduct a situational analysis, which was facilitated by my team. We conducted a situational analysis to find, okay, what are the issues, what are the challenges in Nigeria and all that. And then we did that, from which recommendations were obtained to actually carry out the National Action Plan. So the practical example of where I'm driving at is when the National Action Plan was going to be developed, some workshops were organized in Abuja and different professionals were invited. We had people from research institutes, we had people from different universities, we had environmentalists, we had clinicians, we had people from the government, we had everybody was present. And that is how we were able to draft the strategic objectives and the operational plans for the second national action plan, the NAP 2.0 for antimicrobial resistance that Nigeria is currently working by. So, and how did it happen? Everybody had to take a position. Of course, I was on the research and development team, and some other people were in the surveillance team, the infection prevention and control, and everybody was able to bring in their expertise, bring in their background, their professionalism to get things done. Of course, in the research and development team, I am a veterinarian and also a public health professional, but we also had environmentalists in the research team. We had medical lab scientists, everybody, researchers. So we were able to draft, and that is how the NAP 2.0 came about. So, and I believe this is a very practical example that I can easily lay my hand on how the multi-sectoral approach is actually the best. If we had just said, okay, it is a national action plan, we just need the researchers, we don't need the people that work in the field, it would have we would have missed out on the experience, on their own experience, on their own expertise, and there would have been bias. The One Health approach that was actually involved to get what we eventually got would not have been in place. So there are just no two ways to tackling antimicrobial resistance. One Health approach is just the way. So this is my perspective to this particular question.
Thank you very much, Dr. Tosin. Okay, does any of our facilitator have an answer to give? Have a response, rather?
Yeah, and just to add to what Dr. Tosin has already highlighted, the One Health approach is like a very key cornerstone in not just only addressing AMR, but other global health threats. Yeah. So and there's an aspect of the One Health that is usually kind of neglected in most cases when we're talking about AMR, and which is usually the environment, because the environment is not something that most times we can't see these microorganisms with our eyes, right? So, and we look at our hands, for instance, we can't really see germs on our hands physically, but these germs are actually there. So the environment plays a very critical role, even if we can't see those microorganisms with our naked eyes in the water we drink or in the water we use to irrigate our crops. It doesn't negate the fact that they're actually there. So in tackling the AMR using the One Health approach, every sector has a role to play, for instance, and the environmental sector is also very, very essential. You know, whenever I hear of AMR and One Health, it's unfortunately, especially even back in Nigeria, it's usually dominated by the veterinarians, for instance, the medical people and all of that. And then we kind of neglect the environmental aspect. So I think this is also like a clarion call that One Health is not just about veterinarians or maybe pharmacists and medical doctors. It's also about environmental health practitioners and health communicators, like look at what Amarachi also was talking about. So everybody is actually needed, and even beyond just the three areas that we usually concentrate on, the health communicators are very essential, and also the community members. I think these are also neglected aspect of the One Health sector. You know, we most times neglect those that are community leaders, those that are people that when they speak, others want to hear what they are saying. Like the key stakeholders in the communities are also very, very essential. So when we're talking about One Health, we shouldn't just neglect it to just three sectors like environment, the human aspect, the animal aspect, but even the communities that are being affected by AMR are also part of the One Health. I don't know if you get what I'm trying to say. So it's a more holistic approach, and it's broader than, you know, what we usually like silo it into. So and also even the policymakers are also very, very essential, and even the financial aspect, because sometimes when we talk about these policies that has to be implemented, you know, it requires money. And when we talk about issues like wash, sanitation, and hygiene, because of the lack of the finances to back up these policies, sometimes we have a lot of negligence. So also, we also have to involve key financial stakeholders, for instance, companies, pharmaceutical companies, everybody has to be involved. So I think we need to start thinking of One Health in that approach so that everybody that has a stake in AMR is being involved, and then we can really say that, oh, this is really a real One Health holistic approach. So that's another dimension I also want to add to it. And also to wrap it up, I would also want to add to it that AMR is not just a doctor's problem, that doctors or pharmacist problem or environmentalist problem or veterinarian problem. Every single person has a role to play, and that's why I was talking about the community. So it starts with me, it starts with you, it starts with us educating like each other, educating our lab members, for instance, or our colleagues at work, or our roommates, or wherever we find ourselves, educating people about what AMR is in simple terms and how we can play our own role in ensuring that we stop the spread of AMR. And also, when Dr. Oluwapelu was talking about the role of pharmacists, another important set of people that we usually ignore is the patent medicine vendors, known as the PPMVs. So these are also like, they are the grassroots, the people that the grassroots go to meet when they need antibiotics. And this set of people are also always neglected. And, you know, early this year, our organization, you know, we had like a dialogue with the Pharmaceutical Council of Nigeria, and when we're discussing, we saw that this is really, 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 really a big issue. They don't involve the PPMVs in most of their actions, and they're like, oh, PPMVs, they are just by the way. But these people play a very critical role, because when people are sick, they are the first point of contact because of the cost of hospitals and all of that. So these people too are also very essential. When we're talking of One Health, they need to be involved. Their leaders need to be involved in any of the policies we want to plan, or any of the activities we want to plan. We need to involve all of this set of people, and ensuring that then we really have a One Health approach, when everybody is brought to the table to, you know, share their story and, you know, give their ideas, and then we can inform better decisions. Yeah, thank you.
Okay, thank you very much for that insightful response. So this will be like the final question, and we can round up from here. So my question goes around how to achieve a sustainable intervention. While Mr. Ewo was speaking about wash, talking about wash materials, I remember sometimes this year I participated in an intervention, and we go to secondary school, primary schools. We gave them wash materials, and the principal made a statement while we were handing over the materials to her. She said, during COVID, we had all of these materials, but now we don't have it again. So we went there that time. We gave them some materials as well. So probably after 2-3 weeks, those things might get exhausted, and they may not go back to continuing or sustaining that activity. So same thing is applicable to farmers, individuals. When we go out to go and do outreach, we talk to them, we engage them. They learn at that point in time. If we give them the materials, they use it, but they don't sustain the culture. So what would be your recommendation? Anybody can go and answer this question. What would be your recommendation as regards sustainability of AMR intervention program?
Abi, can I come in?
Yes, ma, go ahead.
Yeah. So that's a very, very good observation. So what I'll say is that prevention of or tackling AMR has to be a lifestyle. We don't have to just meet, annually to discuss some of these things. It has to be a lifestyle, just like, anything we do to avoid being sick or to avoid, getting into some negative settings. Okay. So I think it should be a lifestyle, and the conversation should continue, not only during a World Antibiotic Awareness Week. And everybody should be the change that he or she wants to see. So, and that links up to continuous awareness creation on the menace of antimicrobials, or the menace of antimicrobial resistance. So it's important to keep the conversation going, because it's only when we sustain the conversation that people will have some level of top of mind awareness, then they will act. If we stop talking about this after World Antibiotic Awareness Week, everybody will go to bed. So it's important to look at low-hanging fruit activities or low-cost activities that will help us sustain some of these things. And some of the low-hanging or low-cost activities will simply means you posting something on your social media handle. Probably you've done something in the lab or at your workplace or in your activity or work that you will want to share to, bring people's mind to the fact that AMR is really causing harm. And we should sustain the awareness through our social media handles in our communities in the best possible way that we can among our family members and all that. And everybody should be AMR champion. Because like you rightly said, during the COVID, we had a lot of places with water and soap and tissue and hand sanitizers and all that. But now if you go to several of those facilities, they are no longer adhering to those things. And AMR can be prevented simply by hygiene practices, washing of our hands, making sure that we are on top of our IPC measures. We are using the antibiotics right in our facilities and all that. And everybody should be the change that he or she wants to see. When we leave it to yearly activities, then it becomes, people will forget about it, then they will go to bed and all that. And we should try to engage people with data, you know. So if you work in a lab that you are generating, a lab, be it environmental lab, human health lab, what's it called, animal health, and even with a pharmacist, you know, you generate these data in your lab. How do you organize the data in a way that you can simply share with people that will not require a lot of resources? Because sometimes we, indicate that there are no funds and all that to do, but some of the things you may not need money to post, you know, you may not need money to do them. Posting on your Facebook or your LinkedIn or your social media, you may not need money to do. Of course, probably you need data to do that, but we are always on our social media handles. So we can use that to create more awareness, to sustain the actions and get people more aware of the menace. So in short, let's find low-cost ways of sustaining awareness, creating awareness, because that's the way to get people continuously aware about the menace of AMR. And when they are aware of that, some will change. And individually, we should all try or aspire or continue to be the change that we want to see in our various spaces and champion AMR, regardless, wherever we find ourselves. Over to you.
Okay, thank you very much for the contribution. Does any of our facilitators want to add to that?
Okay, I have something to add just to, can you hear me?
Yes, but not very well. Can you try to speak up, ma?
Hello, can you hear me now?
Yes,
Hello?
go on.
Okay, so it can also be done in schools, whereby there are school campaigns, and it is early education, when like school environment is like the best place in which you can actually incorporate all of these habits. So if it's been done in schools, they have school campaigns, they have role plays, student debates, all of these things. And the campaign should not just be a one-day something, not even, just as Prof has said, not something that is done on a maybe just a week campaign. It's an ongoing process, it's an ongoing thing. It can also be incorporated in school curriculum. It can also be part of the routine clinic and all of that. It can also help um, this being sustained. So just for instance, now in Lagos here, in Nigeria, and also before I go into that, having a unified message that is, it can be, I don't know if you can still hear me because I feel I'm not being heard. Hello?
We can hear you. We can
hear
hear
you.
you.
Okay. Whereby everyone is saying the same thing, everyone is giving the same information from different sectors, be it pharmacists, medical doctors, nurses. Everybody's giving the same information at the same time. For instance, now we are having like a campaign. Let me use the campaign aspect in Lagos. So we having this Lagos campaign running in a unified way. The campaign can be done on the buses, in the hospitals, in the veterinary clinics, and schools, or even on the radios. And everyone is saying the same thing. Everyone is saying use antibiotics wisely, protect your future. So that if it's been done consistently, it builds recognition, then habits then take place. It's now part of their lifestyle. So it's an ongoing process, not just a big thing, not just, oh, we come today, we do intervention, and that is all. It has to be consistent, because when it's consistent, it builds recognition, then it's part of their behavior, and their habits tend to change. That's all I can say. Thank you.
All right. Sorry, can I add something?
Okay, go on, please.
All right. So, in addition to what the previous facilitators have said, so in managing antimicrobial resistance, there is something called the Take Back program. There is a particular country, I can't really remember the exact country, where this was being done, under the aspect of pharmaceutical waste management. So in order to prevent this antimicrobial resistance thing from happening, so what they did in that particular take back program was that at specific points in that particular country, they provided baskets and containers where antibiotics that have not been used, or expired antibiotics, or antibiotics that were not completely used, they are returned back to those specific points. So, and it actually worked because a lot of people turned up, and they were able to like recover those antibiotics. So there is a specific or special way those antibiotics that are no longer used, or that are expired, or that were not used at all, are being, discarded and gotten rid of appropriately, making use of the right methods. So let's bring it back home to Nigeria. Nigerians love free things. And as volunteers, because I personally volunteer for some organizations, slum and rural health initiative and all. So one of the things that we can do to make a change, because as an agent of change, we need to do things differently. Since Nigerians, we like free things, we can attach incentives, we can make use of the same take back program, antimicrobials or antibiotics that are no longer being used or that are already expired. We can have specific places, like maybe in the mosques, maybe in the marketplace, maybe church, somewhere very specific. And maybe you can attach incentives like armbands. You'll be amazed at what actually makes people do things. When they have this idea that, oh, when I return this thing on this particular day, maybe on Sunday, they are sharing free armbands. And maybe in using that method, you can even use that method as a propagation technique. For example, on that handband, you can write antibiotic resistance prevention starts with me. That kind of creates this subconscious mentality that makes them want to do the right thing. Maybe you can share free buckets, free fans, free just attaching incentives is one of the ways we can actually curb antimicrobial resistance. So thank you very much for listening.
Okay, thank you very much, ma. We'll be rounding up now, but I would like to ask if any of our listeners has a question for our facilitators, or anyone has addition before we round up the session. If you have a question, you can unmute yourself and speak now.
Good evening, everybody.
Good evening.
My question goes like this. During the course of the seminar, there was this part of the seminar where one of the speakers said that for companies that need antibiotics like drugs, that they should find a safe means of like disposing it. I'm not saying that. Is there a means of just neutralizing the effects of these antibiotics? Like, instead of having to, like, is there a means of just neutralizing the effects of these antibiotics for like safer, yes, disposal of this drug? Yes.
Hello, please, did we hear a question?
Can everyone hear me?
So, sorry, I'm trying to get the question. So you're trying to ask how pharmaceutical companies can safely dispose their antibiotics residues, right?
Yes. Is there a means of just neutralizing the antibiotics, like so that they will not even have an effect if peradventure it gets into the wrong hands during like the disposal process?
So basically, antibiotics waste or residues should be treated like hazardous waste. And one option that I know that they go for, even in the hospitals when they need to dispose hazardous waste, is through incineration. So incineration like basically involves you taking those hazardous waste and burning them in a regulated manner at a very high temperature, such that they become like ashes and they are of little harm to either the environment or to humans. So incineration is like widely used. And maybe some licensed landfill would also be used. But yeah, so I know of incineration, which is like a proper method. But when it comes to the wastewater, basically every pharmaceutical manufacturing company should have a functional wastewater treatment plant where, the wastewater from the antibiotics production goes into the treatment plant, and then it undergoes various treatment processes. And before this wastewater is being discharged back to the rivers or the environment, there are some regulatory tests that has to be carried out, for instance, to know what is the residual microbial load, or maybe if there are still resistant pathogens and all that. So, and if it meets the standard for disposal into the river, then it can be safely discharged into the water body. So we're talking of two kind of waste: the solid waste and then the wastewater. So those are the two major means of disposing of wastes that are being produced either in the pharmaceutical companies or hospital waste, basically. But I'm not really aware of any kind of other treatment that can help to neutralize the effect, like the antibiotics itself currently. Does that answer your question a bit?
Yes. Thank you very much.
Okay, thank you very much. At this point, I would like to appreciate our facilitators. Thank you so much for your time. Thank you so much for sharing your knowledge with us. Thank you so much for calling us to action as far as for calling us to action about ways and activities that we can use to prevent the spread of antimicrobial resistance. I want to appreciate Professor Bevelin from Ghana, Dr. Oluwatosin from Nigeria, pharmacist Oluwapelumi, Miss Taiwo, and then Miss Amarachi. And also, I want to appreciate every of our listeners for joining, for staying till this moment. Thank you very much for joining. It's really an interesting and impactful and insightful session all along. Thank you very much. And finally, I would like to charge every one of us to take action and to also continue the antimicrobial stewardship. We should continue with the advocacy, regardless of where we find ourselves. We should always try to engage people on how to prevent antimicrobial resistance. Thank you very much for joining us today. See you all some other time. Thank you very much.